Hello, my name is John Mickley, and today I'm going to be talking about the healthcare system of Ireland compared to the healthcare system of the United States. First, to compare the two, we're going to, the US kind of economy and population is about 60 times the size of Ireland. So just keeping that in mind as we're comparing these two healthcare systems. First, to talk about the type of healthcare system that they have. The US has kind of a hybrid between a single payer and kind of a multi-payer system. The multi-payer system is seen in the private health insurance, where most people get their insurance through their employer, so employer-based. And then there's also an individual private market that is very small. On the other side, there's the government, which is more the single-payer system. With the government, they cover the very low-income people with Medicaid and the older people with Medicare. There's definitely a gap in coverage between the people who get Medicaid and the people who have employer-based, so the people who are in the middle where they are employed, but they make too much for Medicaid, but their employer doesn't provide insurance. They can be kind of stuck without any coverage. On the other hand, Ireland is more of a comprehensive government-funded public health and kind of coverage system. In 2004, they came out with the Health Service Executive, which really provides service for anyone who's been living in the country for over a year. It works on different cards. So the first card is a medical card, and that's for about 30% of the population, very low income, who get all of their healthcare coverage provided for. On the other hand, if you don't qualify for that, you can qualify for a general practitioner card, where you can see any primary care type of physician or nurse practitioner for free. And if there's also another card for drugs and prescriptions, where anyone is available for that, and it maxes the amount that you can pay for a prescription. So overall, Ireland mostly funds their healthcare system through taxes and subsidies to people who are paying. There's also a private market within Ireland, but that's mainly for people who are wealthy and not sick. Once you become sick, you're mostly just covered under the government. To look at a little bit more of kind of numbers for each one, we're going to look at population health. The first place we're going to look at is life expectancy. For life expectancy, you can see that the Ireland overall is about 81.5 years, compared to the US, which is 78.7 years. It's also, the US is lower for the males at 76.4, and compared to Ireland, which is 79.6, females 83 compared to 81. So across the board, you can see that the US healthcare, or the US population actually has a lower health or life expectancy than Ireland. And this is if you compare it to other developing and emerging countries. Ireland and the US is kind of lower than most of these countries, and Ireland, again, higher than the US, but more in the middle of the pack. Now, if we see that, so the US had a lower life expectancy. Now, if we look at healthcare spending, the US actually spends more on healthcare than Ireland, about $10,000 per capita in the population, compared to Ireland, which is only around $5,000. So despite not living as long, the US actually spends more per person on healthcare. And you can see this, again, compared with other nations. They're both above the average, but you can see the US is well above Ireland here. And if you compare this, also an interesting thing to see is just based on what the government kind of provides for the people in America, about all of the amount of money that the government pays, which only covers about 50% of the population, is what almost most countries use to cover their whole population for healthcare. So you can see that healthcare in the United States we spend a lot more money on healthcare. Now, to look about more of kind of the operation of the healthcare system, we're going to look at emergency department visits per 1,000. And in Ireland, that comes out to be about 278, compared to the US, where it's about 432. The emergency room is really what you want to use for people who are have like a trauma case or are extremely sick. But when you don't have coverage for everyone, people start using it as more of a primary care visit. And you can see that is a main reason why the US is so high. So you can say that the Ireland system seems to be operating a little bit better if we just look at these emergency department visits. Now we'll look a little bit more at the public health prevention aspect and looking at tobacco control. So Ireland actually has a higher prevalence of people who are smoking, around 20%, compared to the United States, who's at about a 15.5%. But if you look at, they both currently have organizations that are in charge, as well as the governments, who are really attacking this problem of tobacco and really going after the industries who are placing ads and targeting different populations. But Ireland's kind of system didn't really start until the early 2000s when they started making legislation to reduce the ads and restrict of what they can do. In 2013, they came out with the Tobacco Free Ireland program, where their goal is to be completely tobacco free, or less than 5% prevalence, by 2025. The United States kind of started more in 1964 with their Surgeon General report that linked lung cancer to smoking. And you can see that they've done a lot since then. So definitely both countries are doing pretty good at public health. You can see here that for Ireland, they started about 30% of the population kind of smoking in the early 2000s. They're down to 20, and it seems a nice downward trend, so we can hopefully that will continue considering the programs that they have going on. If we look at the United States, they started up around 40%, or nearly 45%, so almost half the population in the 1960s, and we see a downward trend again for them. So they both are doing pretty good at trying to combat this issue of tobacco, considering it is the number one preventable cause of disease and premature death in both countries. So they're both doing a good job at attacking it. Now we're looking at the physical environment, a little more at air quality. If we look at air quality for both of them, based on the standards that they have set, they both fall under their standards, or they succeed in obtaining, not going over their limits for air pollution. Ireland is below all the EU limits, and the United States is below all their national limits. Both the EU and United States national limits are very similar to each other. The United States, actually, their limits are a little bit lower, but overall, I'd say their air quality is pretty good. They're not all underneath the World Health Organization kind of guidelines, but again, you can see that they're doing a pretty good job at air quality. This is the United States. You can see they're all below their standards. And for Ireland, you can see that the air quality is good compared to if you just look at these. Upper limit here is what the EU says needs to be the limit, and then the WHO on some of them have lower limits, but they're pretty close on those. Next, if we look at a little bit more of the access to healthcare, we can see that we'll look at primary care and specialty care physicians. In Ireland, they have about 287 physicians per 100,000 people, compared to the U.S., who has 257. So Ireland actually has more physicians per 100,000 people in their population. And I think the big thing to point out here is the primary care. Ireland has about 184 compared to U.S., which is 145, which kind of explains why there's such high waiting times in the U.S. for primary care, which people can wait up to like 6 days is pretty typical for primary care, compared to Ireland, which is only 1 day for primary care. But if you look at specialty care, Ireland is up in the hundreds of days, when the U.S. you can get a coronary bypass surgery in usually less than 24 hours. So you can see the U.S. is a little bit more concerned about the areas that are making money than the areas of more preventative medicine. You can see physicians here, Ireland is here, and the U.S. is even lower than them, so they're lower than actually most of the developing nations. And you see also Ireland has a very high wait time, which we talked about. So we're also going to look at kind of the overall social economic environment of the population. For Ireland, you can see that about 8% of the adults and 11% of children are in poverty, compared to the United States, which is 12% and 18%. So the United States seems to, although they have a more wealthier nation, their economic and social environment is not very good for the lower class citizens. And kind of, as we can see, these poverty rates, they've been pretty consistent for the U.S., and they actually have gone up a little lately for Ireland, but overall they've stayed pretty similar. So kind of the major takeaways from today are that the U.S. is mostly private. It's kind of half and half between private and publicly funded. Ireland is mainly government funded. With this being said, the U.S. spends a lot more per person compared to Ireland, but they don't seem to be getting better. Sometimes they're getting worse results, but really not many better results than Ireland. You see the U.S. dies sooner than Ireland, and kind of the U.S. is more focused on these specialty care physicians, and not really the primary care, where we can really get some preventative medicine. So comparing the two today, we can see that the U.S. might have some ways that they can learn from the Ireland system, and ways that we can improve the efficiency of our healthcare system in the U.S., because it does not seem to be operating as well as it should, considering how wealthy and developed of a nation we are. Thank you.